Before birth, the aorta and the left pulmonary artery are connected by a blood vessel called the ductus arteriosus. This vessel is an essential part of fetal blood circulation. Within a few days after birth, the vessel is supposed to close. In some babies, the ductus arteriosus remains open or patent. This opening allows oxygen-rich blood to mix with oxygen-poor blood, a left-to-right shunt that may have severe consequences in newborns. Usually, a continuous murmur in the second left intercostal space can be heard. If the patent ductus arteriosus is large, it may cause heart failure, and patients, usually newborns, must undergo surgical treatment. Increased pulmonary vascular markings may cause respiratory distress in children with patent ductus arteriosus. Usually, a continuous murmur in the second left intercostal space can be heard in newborns and infants with patent ductus arteriosus. The most useful methods of diagnosis are chest radiography, echocardiography. Chest radiography does not allow a comprehensive diagnosis of patent ductus arteriosus. It may show no evidence, or, in those cases with large patent ductus arteriosus, it may present cardiomegaly with increased pulmonary vascular markings. Echocardiography allows a comprehensive diagnosis of patent ductus arteriosus. Short axis view shows turbulent blood flow from the descending aorta into the pulmonary artery across the patent ductus arteriosus. Color flow mapping shows a medium-sized left-to-right shunt. The suprasternal view shows the ascending aorta, the aortic arch, and the descending aorta. This view better demonstrates turbulent blood flow across the ductus into the pulmonary artery at the site of the aortic isthmus. Medical therapy varies according to the age of the patient. Ibuprofen therapy may be useful for closure of patent ductus arteriosus in preterm newborns. Medical therapy for full-term newborns and infants may be useful in those cases with heart failure that are waiting for surgery. There are two types of corrective surgery for patent ductus arteriosus: ligation or division suture technique. The patent ductus arteriosus is firstly isolated and then is ligated with silk ties or metal surgical clips. The division suture technique involves, once the ductus has been isolated, placement of vascular clamps and division of the patent ductus arteriosus. Approximation and suture of the cut ends is then performed. The guiding catheter is inserted through the femoral artery and advanced into the aorta up into the patent ductus arteriosus. The catheter is then pushed through the patent ductus arteriosus into the pulmonary artery. The distal disc is opened into the pulmonary artery. Then the proximal disc is opened into the aorta. Once position is confirmed by echocardiography or angiography, the guiding catheter is retracted to deploy the device. Other closure procedures may be performed for patent ductus arteriosus, but these procedures are performed via a femoral or jugular venous approach.